Mayor Michelle Wu as she launches the Be Together policy and initiative. This is something that we know will save lives, will improve the economy, will improve the quality of the lives of the residents of Boston. So we applaud your leadership, Mayor Wu. We applaud your public health focus. We know that the science and the evidence-based data shows that vaccines, boosters, and compliance with the CDC COVID-19 infection control guidelines are the best strategies we have to save and improve life. The prolonged negative impact of the virus and the continued increase in the infection rates and the unpredictability needs to be addressed. And we applaud your focused leadership in working with experts, looking at the science and developing strategies that we know will have a positive impact on the city of Boston, those who come to the city to do business, and those who live in the city. Besides the health impact, we see the negative impact on our children. At Whittier, we're seeing increased mental illnesses due to the social isolation, anxiety, trauma, suicide ideation rates. Our youth's growth are being stunted, and we know the best place for our brown and black children are in the schools, so we applaud that. So from an economic, from a health and well-being, from a public health, from our youth, we are grateful that this policy is being implemented. We stand ready to continue our partnership with the City of Boston and the Boston Public Health Commission. We also stand ready to support city employees in increasing vaccination rates, going to them, meeting them where they are, so we can all be in compliance and have a healthier 2022 and beyond. Please join me in welcoming our Mayor, Mayor Michelle Wu, to the podium. Thank you.
Thank you so much. Thank you so much, President. Frederica Williams is just such an example of the type of partnership and constant leadership that we are so grateful for across our city. Our community health centers play a critical role day in and day out in the health and well-being of our residents, but especially during this pandemic, their services and their platforms and their outreach has been essential in our work to close gaps in our communities and to meet each resident where they are. I want to give a special thanks to Whittier Street, not only for hosting us today and for hosting this very, very productive and important vaccination clinic. I heard from the doctors here that more than 250 people a day are getting vaccinated here, along with testing available to residents from every single background across our city. Whittier Street was also the community health center running the mobile clinic and van that was deployed at our first night celebrations, where we saw hundreds of people receive their vaccinations and boosters because of that innovation and that leadership. So thank you so much. I'm grateful to be joined here by the President of the Boston City Council, my friend and colleague Ed Flynn as well, and I'll invite him up after I'm finished to give a few words on behalf of the Council as well. Today I just wanted to, I'm here to answer any questions and be out making sure people remember that we still have work to do in closing vaccination rates. Today's launch of our Be Together policy means that we are taking important steps on the policy side to close those gaps and continue protections for our workforce and for our residents. I continue to hear from our partners in healthcare and in our health institutions that the ongoing strain on our healthcare system overall is still being driven by gaps in vaccination rates. Just this morning, we saw news of yet another large player in our hospital system needing to push back even more surgeries to make space, because we see very badly needed beds and capacity within our hospital system being pushed out. COVID-19 and unvaccinated patients who who are suffering from severe illness because of COVID are squeezing out the capacity for needed procedures and other health treatments. When you have a surgery that is deemed not immediately necessary because our ICUs and emergency rooms are full with unvaccinated COVID patients, by the time that gets kicked out several months or a year later, you're talking likely an even more intense support that's needed, potentially an even more serious surgery that's needed at that point. So every bit of delay that we see now, every month, every week that goes by that we are still seeing the effects of COVID-19 and this pandemic drag on, is creating ripple effects later on for all of us. We all need a healthy and accessible healthcare system, and that is very much tied up in preventable instances of severe illness and hospitalization due to gaps in COVID-19 vaccination rates. And so our policy is meant to be a strong support for our healthcare system and for residents at large. We know that this works. In the city of Boston, our city workforce also is now under the first phase-in of our vaccination policies, which require vaccination and across the city workforce. We've seen the numbers jump over the last week. Nearly 700 additional city workers have been vaccinated after this policy, or in leading up to this policy taking effect today. We will continue to take steps in partnership with our community partners and the City Council and other levels of government to be leading the way and using every possible tool that we can to end this pandemic. So I'll invite up President Flynn to say a few words.
Thank you, Mayor Wu, and thank you to the team here at Whittier Street Health Center for providing excellent medical care and for doing vaccination and testing, especially to our vulnerable residents. Honored to be here with the mayor of the city, and it's also important that we continue the outreach to our neighbors, to our immigrant neighbors, communities of color, making sure that they have equal access to vaccination, testing, face coverings as well. And the other thing I wanted to share is I think it's also important during these difficult times in our city and our country that even if we disagree with each other on what is the right approach, it's important that we treat everyone with respect and dignity, and to make sure that we listen carefully and we treat everyone fairly. Just the level of intimidation that you see across the country is growing, and we have to dial it back to make sure we treat everybody fairly and with respect as well. So I'm honored to be here with my colleague, Councilor, former Councilor and Mayor of the City of Boston, Mayor Wu. Thank you, Mayor.
Thank you. Questions?
So, Mayor Wu, I'm sure you've heard that there's maybe around 500 people who braved the cold today to protest across the city against this new indoor vaccine requirement. What would your response be to the people out here who are saying this isn't the right thing to do?
We are working every day to end this pandemic. The pandemic affects all of us, whether or not you are choosing to be vaccinated. You or your family or loved ones will need access to our hospital and healthcare system at some point. And as that gets crowded, and as COVID, unvaccinated, severe cases of COVID are crowding out everything else, we are going to pay for that in the months to come as well. We also know that our small businesses are already, one by one in different cases, have been weighing the decision on how to keep their workforce and customers safe. But without a clear policy that applies across the board, we put the burden on our small businesses to make the right calls, to absorb the heat of it. This is a citywide policy that is based on the science, that is based on the needs of our healthcare system to end this pandemic, and it is a citywide policy decision. I am happy to be held accountable for that. Please, as you are out and about in our city, do not heckle our restaurant owners and small business employees. This is a policy that is meant to be a public health support for all of us. It is not on the shoulders of our small business owners, and I will continue to stand with them, support them, and make sure that the city is providing every resource we can to get our businesses back up and running and support our economy as we recover.
And going off of that, speaking of small businesses, we did talk to a couple small business owners in the city over, the last week leading up to today. And some of them have expressed that it's difficult for them to have the staff right now with the spread of the variant and staffing shortages to be able to implement, having someone at the door to check. And, we talked to one restaurant in the North End that's like, we're just doing takeout because we just don't have the staff right now to make sure that we're constantly checking and checking and checking as people come in. So is there a potential negative side, and is that something that you've outweighed, and what have you been hearing from small businesses?
Our small business owners have been bearing so much over the last 18 plus months, and it's really going to take all of us stepping up, doing everything we can to end this pandemic so that they can continue to thrive. They continue to be anchors of our communities. In other cities that have these policies, once it is fully implemented, it becomes part of the culture and the regular rhythm of small businesses, so it is really not intended to be overly burdensome. We've had a lot of webinars and open Q&A sessions. We've gone door to door throughout many of our small business districts just to be present and provide support. Each business is asked to and has been, wherever we could, hand-delivered a sign that goes in the window, so the burden is not on that business to need to explain or spend time documenting everything. That sign has everything that anyone needs to know, and the city will be there to support the implementation of this.
Couldn't you say the opposite, which is, couldn't you say, change the messaging around and say this could be good for restaurants, meaning that the amount of people that may not be able to go now will be offset by the amount of people who now feel like they can and go to a restaurant because now they feel safe, that everybody in the restaurant is vaccinated, including employees?
We've heard that from a lot of restaurants and a lot of small businesses and customers too. And many of the businesses that we've spoken to had already decided that for their own workforce's health and safety, they were going to implement this on their own several months ago. And so it is about creating a sense of revitalizing our restaurants and small businesses, making sure people can feel comfortable going out again, and making sure that we are doing everything we can to protect our workforce and customers.
Mayor, how many municipal workers are not in compliance with the requirement to get the first dose?
I have some of the numbers here. Let's see. I might have to get that one specifically. Okay, as of 10 a.m. today, we are at 17,435 employees who have met the requirements. Okay, I don't have the inverse number, so I don't exactly know what the denominator is at total that are not there. But that has been a big jump of several hundred employees even in the last week. So we're going to continue. We're going to continue to make employee-specific vaccination clinics available as well. Those have been very well attended over the last week, and continue doing everything we can to support our workforce in getting vaccinated.
How many applications did you get for exemptions, and have any been granted?
I don't have that number yet, but given that the deadline falls on, it starts today, the review of those requests and the review of every person's status of whether they've fully uploaded the proof of vaccination will begin in earnest on Tuesday, given that Monday is a holiday as well. And that way there will be a few days of reaching out directly to employees who still need to submit proof of vaccination, and then further steps will kick in the week after that.
Very clearly.
Have any businesses been fined, and what went into the decision to push back on the mandate, and will there be more changes coming
Push back
on the mandate?
the timeline, you mean? Or what do you mean push back the mandate?
Push back on the mandate.
Okay, sorry, say it one more time. Right. So the question is, are there businesses that have been fined? So no businesses have been fined as of today. Today's the very first day, and the first phase has really been working with our business owners to make sure that there's full support and education. We have followed closely the example of other cities where there's a period of time of working very closely with those businesses before any fines might take place. And sorry, what was the reason for the pushback?
Right, and what will be more changes
Will there be more changes to the policy? You know, COVID is changing every day. We have been implementing this policy for the last several weeks. There's been a lot of work that has gone up to this day already in terms of working with our business owners, working through our own internal personnel processes, and making sure we're updating all of those internal procedures as well. There was no pushback to the mandate or anything like that. Today is the day to in terms of the internal mandate, internal proof of vaccination, today is the day to have uploaded all of that information. It will take some time to process that and conduct the individual outreach person by person, because we really want this to be a policy that boosts vaccination rather than is punitive to our employees. And so we're going to keep working with every single person. And we've been proceeding along our timelines as originally planned.
Mayor, at what point do absentee rates?
Business owners, the city requests or describes requests for reasonable accommodations for medical, religious, and civil rights reasons. Is that what you expect the city to use as criteria when it evaluates requests for accommodations?
The processes for exemption requests have already been laid out with the city's current vaccination policy as well, so it is largely around medical and religious exemption requests. And those are evaluated on a case-by-case basis, but again, given that today is the sort of deadline day, that will happen over the next couple days starting next work week.
Mayor, at what point do student and teacher absenteeism rates make in-school learning a losing proposition and make it necessary to really consider going back to remote learning?
So we're tracking day by day the absences within our workforce as well as the student attendance rates. In fact, both have been increasing. Student attendance has been climbing steadily. It was at about 70% when we first returned from winter break, and it has gone up since then. I think the latest number, just creeping up a few percentage points every single day. The workforce absences were about at 1,200 staff out across all of BPS school staff a few days ago, and those numbers, to the best that each school leader has been able to predict when staff who are quarantining might come back and other issues, that is seeming manageable in terms of the number of vacancies or the number of absences in different places. The overall issue is that our staff are exhausted. It has been years working under near impossible circumstances with so many additional safety precautions to administer classroom by classroom and on the ground, with covering for absences from someone that were unexpected because of positivity rates in the community, with teachers who are parents themselves having to stay home because their children have been exposed in their classrooms to someone who has tested COVID positive. And so we really see the ongoing layers of impacts on our school system. And again, this is why policies like Be Together are so important and necessary. What happens in our classrooms really is the result of what our family members and educators are experiencing out in the community. So every step we can take to keep transmission down, to boost vaccination out in the community, makes it more possible for a high-quality, supported learning environment.
Even though you may have the vast majority of students, 70%, 75% able to go to school, it would seem as though those who are being diagnosed with COVID are catching it in school. And if that continues to be the means of transmission for 30% of the student body, and that just stays steady with 30% always catching COVID in school, at some point does that become a factor, and it's not a fair or a wise proposition to make everyone go to school when you know you're always going to have 30% of the kids going out sick with COVID?
So our school leaders and our teachers and educators, our school staff, let me just say more broadly, our school staff have this down to a science of how to really protect young people in our classrooms. We are moving as a district to more frequent testing. There are clear parameters, and the kids are used to having masks on and knowing what to do and how to be safe. And so there's very little evidence that there's transmission happening within our schools. Much of it is the fact that when community positivity rates are as high as they've been, over 30%, right? We were at 32% community positivity last week. That affects then what happens in our classrooms, but it's not. Our school leaders and our teachers are doing a great job of making sure our classrooms are safe.
Mayor Wu, there was discussion among opponents of the municipal vaccine mandate of filing their exemptions en masse at the last minute. Did that materialize?
You know, I need to check with the team. We'll follow up on that point. I actually don't have the numbers yet of if a flood came in at the last minute or anything.
And then also, you sent out some tweets this morning addressing sort of the toll that the demonstrations have been taking on your family and your neighbors. Would you consider talking about that? And also, Councilor Friend, I'd be curious to know if your father ever endured those kind of at your doorstep demonstrations during his mayoral administration.
So it's been a pretty regular occurrence. 7 a.m. We're joined by a crowd outside with megaphones, and I've been in politics for a long time in Boston. I have never once backed down from a position or an issue because people are yelling or getting loud. I think it's important, as the tone and intensity of misinformation and rhetoric ramps up across our country in politics, to note what this means on a human level for people who are living through it. And again, I am used to this. Unfortunately, many women of color serving in positions of leadership are used to this. But I live in a two-family home on a residential street. My next door neighbor is a 96-year-old veteran who deserves to have his sleep in the morning. There are many, many families on our street who have young kids who are getting woken up by hateful messages and loud words being broadcast down our street and beyond over megaphones. I am eager to engage with residents in the many decisions that we're making, and I know now is an incredibly stressful time. It is a scary time. It is an exhausting time for all of us. So I think it's important to shed a light on where we are as a country, that there is deeply rooted misinformation that we need strong policies to counteract. And every day I'm reminded of that at my house, and every day it makes me surer that Boston needs to lead the way on these policies. President Flynn?
Thank you, and I completely agree with the mayor's comments. Yes, when my father was mayor for 10 years, our family was also subjected to protest out in front of our house. But I think the difference is the level of intensity that's happening today wasn't there when my father was mayor. And I honestly believe some of it is related to an anti-Asian sentiment that we have in this country. I proudly represent the largest Asian community in Greater Boston. I have a wonderful relationship with them. But this pandemic has especially hit the Asian community very hard across the country, and including here in Massachusetts. So I think what's important is we have to make sure we treat our immigrants with respect and dignity. And I'm proud to work closely with Mayor Wu, because I know she's dedicated and committed to the residents of the city and treats everybody fairly as well. So I just wanted to say thank you to the mayor, but also to come here and to support the mayor as well.
Mayor, one last question. I'm sorry to keep you here so long. But I know a lot of people this week have been downloading the QR code for their vaccine, part of the state's program. Are businesses in Boston equipped? I don't know, and forgive me if you've talked about this already this week, but do they scan the QR code and something pops up, or are they just looking to see that you have one that matches your name? How does that process work?
Our goal was to make sure this would be as seamless and low barrier as possible for our small business owners to implement. And so we require only proof of vaccination. That can be in any form that you show it, whether it is the state's app, whether it's the city's app, which is a little bit more of a simplified version of it, whether it is your physical card, your actual vaccination card, a picture of the card on your phone. Any form of vaccination works. The city did release our own app, which is a little bit different from the state's and similar to some that other cities have implemented. The state's app is great because it is a high security, intended for getting on an airplane and proof. It's quite involved in some ways, and so it'll be very useful for a variety of situations where you need that full legal documentation. The city's app is meant to be an even simpler version to access, where you can essentially keep a photo of your card stored right through that app.
And what's the name of the app one more time? I know I could look it up, but.
The city's app, I think it's called our Be Together app. Yes.
Thank you.
Who in city government will evaluate the request for exemptions from the vaccine mandate from municipal workers?
That runs through our administration and finance cabinet. Great. Good. Anyone need Spanish? You okay?
Thank you.
Okay. Thank you, everyone. Nice to see you.
Mayor,
Yes.
since you said that, could you do a summary in Spanish
Sure.
for my sake? Just a summary.
Okay. Hoy es el primer día de nuestra policía Be Together para requerir la prueba de vacunación para entrar en algunas empresas como restaurantes, bares o entrenamiento o otros lugares en nuestra ciudad. También es la fecha para los empleos de la ciudad de Boston, el gobierno municipal, para demostrar prueba de vacunación también. Es muy importante de cada persona en nuestra ciudad, cada sector y nivel de gobierno apoyan a los empleos en nuestro sistema de salud, en los hospitales y otros y como centros de salud comunitario también, porque la pandemia es una crisis en este momento. Entonces, estoy muy feliz y muy agradecida de cada parte de nuestro gobierno y cada parte de la colaboración entre la ciudad y los centros comunitarios y centros de salud para asegurar que Boston pueden liderar en nuestra lucha contra COVID-19. Okay, gracias.